Hello folks, and welcome to another edition of Eyecare Today. I'm your host, Dr. Thomas Kislan, and remember, if there's ever any questions, please feel free to contact us at our two office locations. The first is Hazleton Eye Specialists on the Beltway in Hazleton. That's 453-2020. In Stroudsburg Eye Specialists on 9th Street, 421-3342. And as always, our website, www.drkislan.com. This is the second part of two shows, and I'm joined again today by Dr. Frank Bucci. We're coming to you from Wilkes-Barre, Pennsylvania, and we're coming to you from Dr. Bucci's Surgery Center, the Angelina Teresa Bucci Eye Surgery Center, located again here in Wilkes-Barre. Dr. Bucci, thank you for joining us again and talking to the folks at home really about how we can give patients this freedom from glasses and contacts. And in our last show, we talked a lot about cataracts and the options now for patients who have cataracts, not only to make them see clearer, but make them see better without glasses or contacts. So I would just like to review a little bit. You gave a great analogy in the last show about what a cataract is, how the lens of the eye is like a grape, size of a grape. Talk a little bit about that analogy and just educate the folks at home about what a cataract is.
Okay, we'll quickly review what a cataract is, and then, so we said that the eye is really the size of a grape, and inside right in the front of the grape is a mini M&M. So the cataract is the exact size and shape of a mini M&M. When we do surgery, we enter through a small wound. We take the coating off the M&M, break up the chocolate with either sound waves or light waves, remove it, and then we inject a lens that form fits into the pouch. The pouch shrink wraps on it, and that lens is right there for the rest of your life, right where God had the original focusing power to start with. Basically, I do 90% of our cataract surgeries, we do that, what I just described, in 4 to 6 minutes. So with a complication rate of 2 per 1,000.
No needle, no stitch, no patch, no pain, no restrictions.
Full activity in 1 day.
And the big point you made also, a lot of patients ask about, do I have to stop my aspirin, my Coumadin, my Plavix, any of my blood thinners? You don't have to stop any of those because you don't touch it.
We don't touch the blood vessels in the eye.
So, you know, really, it's not cataract surgery like it was years ago. It's a real simple procedure, and the implants that are used now are a little bit different. Like you said, we can do a distance implant, or you can actually give patients that freedom to have vision without bifocals. So just explain a little bit about how that's done.
Well, so again, like you said, we can put various lenses in the eye that have various optical properties. You can use the generic Medicare lens, which will be distance only. You can use an upgraded premium distance only lens that gives you better quality like HD TV or high definition. Or you can use a multifocal lens, which will allow you to see distance and again have additional focal point at 15 inches where you can see literally the phone book. And with two of those lenses, you have a 98-99% chance you'll have no glasses the rest of your life. There's even one that you put in the eye and it will neutralize any stigmatism that you have left over in the cornea. So instead of having a stigmatism correction in your glasses, it'll be in the implant, and that'll give you excellent distance vision without the need of glasses.
And astigmatism, just to kind of review, is a little bit where the front of the eye is shaped like almost like a football instead of like a baseball, a little oblong in shape, and kind of the way God made some patients.
Right. You want to, when we do astigmatism surgery, I tell the patients we're rounding up the cornea, more like half of a basketball or baseball instead of like a half of a football, which is kind of like elliptical.
Now, when you do the surgery and we correct the patient's vision, they come in for the initial consultation. We look at the health of the eyes, and we touch a little bit on the last show. I want to go in a little bit more depth how important it is to look at the front of the eye, the cornea, make sure that's healthy. We look at the back of the eye, make sure that's healthy, because if the back of the eye isn't working, it doesn't matter what we do in the front, they're not going to see well. So explain a little bit what we're doing there, and then I want to talk about dry eye and some treatments that are out there now for that.
Right, to reiterate what you said, the back of the eye acts like the film of the camera, so that has to work to get a good picture, and the front of the eye is the cornea, and you have to have a nice, pristine, moist surface, what's called a healthy tear film. And the tear film is made up of a water layer and an oil layer, and over here in this picture you see the water comes from the tear gland, comes across the eye, and it goes out these tiny little holes in our eyelids into the back of our throat. So that's where our water layer comes from. And then the oil layer, there's 30 oil glands on the upper and lower lid, and you see one here demonstrated. And you want a nice, thin, clear oil coming out of there, like kind of thin safflower oil. Unfortunately, a lot of Americans, with our high cholesterol and everything, you have thicker oils. And so we do things we can to treat this oil to make it thinner. So then you'll have a nice water layer and a nice oil layer. If the oil layer is abnormal, the water just evaporates off the surface. So you hear all the time patients have dry eye, and I keep using my tears, but I never get better. Because half the dry eye in the United States is from an abnormal oil layer. So this is newer information, and advanced doctors that treat dry eye are more aware of this. So we can give you tear drops and tear gels and tear plugs to help the water layer, and even Restasis you all see advertised helps the water layer. But to help the oil layer, we give frequently a very high grade omega-3 supplement. And this supplement, the omega molecule, not to get too technical, has a backbone of glycerol and 3 fatty acids that deliver the healthful things. When you have to purify the omega-3, it's distilled in alcohol, and then ethanol replaces the glycerol, and you end up with an ethyl ester omega. Unfortunately, many Americans for the last 20 years, companies look in Norway and see a rather inexpensive ethyl ester omega and think it's the same as a high quality fish oil, and we buy it. And if we go to a number of different stores, you'll see this ethyl ester omega, and it's kind of confusing when you go in the drugstore which to buy. We use one where there's one extra step, and it has a fancy name called reesterification, where basically you knock in, the glycerol comes in, replaces the ethanol, and this is a pure triglyceride, and one, you don't burp and belch, and two, you get high blood levels that not only help your eye, but lower cholesterol, lower triglycerides, take joint pain away, treat all inflammation in your body, but thin out this oil here, plus take away inflammatory mediators and give a nice thin clear oil that really helps prevent evaporative dry eye. Another new treatment called LipiFlow, we actually, and that would probably take a whole show to talk about, and I'm sure we'll do that in the future, literally liquefies, heats up, and massages all these glands and extracts the bad oil and opens the glands up. And not only do you get higher quality oil that the omegas give you, but you get higher quantity of oil. And really, it really can be effective in treating dry eye, this kind of dry eye that up until now we didn't have anything that went directly at the cause. Now we have something that goes directly at the cause of the dry eye. And when we come back from our break, folks, we're going to touch a little bit more on this form of dry eye, this evaporative form of dry eye, and the omegas. We're going to talk a little bit more. So we take a quick break. Again, you're watching Eyecare Today, and we'll be right back. Welcome back, folks. You're watching Eyecare Today, and I'm your host, Dr. Thomas Kislan. Remember, any questions, feel free to give us a call, 453-2020 in our Hazleton location, 421-3342 in our Stroudsburg location, www.drkislan.com. And you can also give Dr. Bucci's office a call, 877-Dr. Bucci, that's 877-DRBUCCI. And we are joined today by Dr. Frank Bucci, this second show where we're talking about giving patients freedom from glasses and contacts. So again, Dr. Bucci, thanks for joining us. My pleasure.
Before the break, we were talking about dry eye and omega-3s and how important it is to talk to patients before surgery about the health of their eye, because if you go and do surgery and they don't have a healthy tear film or a healthy retina, they're not going to see well and the surgery isn't going to be successful. So there's many treatments out there for dry eye. You talked about a bunch of them: Restasis, punctal plugs, LipiFlow, omega-3s. And I want to go back a little bit and just kind of review with the patients, if we can, how important the oil part of the tear film is, because like you said, you've got the oil part of the tear, you got the water part. An analogy I use is you kind of have this oil slick on top of the water, and if that oil slick isn't there, the water just evaporates away and the dry eye gets worse. So we need to keep a nice oil layer there, and like you said, that oil, it's almost like olive oil or clear motor oil that comes out of these glands. And if it's not, it gets thick and inflammation occurs, and the patients don't see well because they're not secreting the proper oils. Yeah. So one thing you mentioned was about the omega-3s and how important it is to take a proper omega-3. And I know both of us, we're big fans of the PRN brand, the physician recommended nutraceuticals. And we did a study a couple years ago, and it was one of the only red blood cell absorption studies done by eye doctors that I know of. Tell the folks a little bit about that study. And we don't have to go into technical detail, but I think that was a pretty important study, and I know a lot of our colleagues were very interested with it, and it was kind of groundbreaking. So I'm kind of proud of that. So tell the folks about that.
So what we wanted to say is when you take omegas, the good part that delivers the healthful benefits kind of jumps on red blood cells and then circulates through your body. And we mentioned before that not only do you get a lot of eye benefit, but it lowers cholesterol and triglycerides and helps joint pain because it goes to your whole body. One way to detect how effective a given omega is to, and it's great, you don't have to draw a lot of blood, you do a little finger stick, and there's an excellent, Dr. Harris developed a test where you can take the blood and find out what's the saturation. In other words, there's a percentage. For instance, Dr. Harris developed from 0 to 4%, you're at cardiac risk for a cardiac problem. From 4 to 8%, you're kind of neutral. And if you can get 8% or more saturation of these good omegas in your blood, you're actually cardioprotective. And that's where his research lied. So we use that same finger stick to compare our omegas to other omegas. And the leading seller nationally was Nature's Made, and we compared ourselves to Nature's Made and another ocular brand. And again, what happened was they were the ethyl ester omega, the one that's popular and sold in stores because it's a little less expensive. We compared to this pure triglyceride, and the saturation was dramatically higher in the one we prefer, and we were just demonstrating why we prefer it. So, we was getting up to around 8%. So not only was doing beneficial things for your eyes, you had the other systemic side effects that are all good side effects.
So in a nutshell, we were able to take a finger prick test, a little bit of blood, and determine how much of those omegas the patients are taking is actually getting into their blood, which is getting to their tissues.
Right.
And I think what's interesting, what we found in that study is, you mentioned the Nature's Made brand, which is very common when sold in like CVS and Walgreens and things like that. Patients would actually have to take probably about 12 or 15 of those to get the same blood saturation that they were getting with 4 of the PRN brand.
Right, and what would happen is you'd get so much burping and belching and stuff, you wouldn't even be able to tolerate to take that. So you really can't, and patients will become non-compliant. And you think it's less expensive to use the one that costs less, but if you have to take so many more pills, it's really less expensive to take the pure triglyceride form.
So for those patients out there that maybe Aunt Joni said, well, take fish oil, it's great, and they're taking like 1 capsule a day of this CVS brand, is it really doing anything?
Well, it might be slightly better than nothing, but really not, unless you, here's a good example. The American Heart Association says you need 2,000 milligrams of the fatty acid ingredient to lower cholesterol. And your typical Walmart, you might get 70 or 100 per pill. So if you took 4 pills, you'd be at best 400.
But that's not absorbed.
Right, even that isn't even absorbed. So you don't even get the full 400 in your system, where the PRN brand, it's 520 per pill. So if you take the 4 a day we recommend, usually 2 at breakfast, 2 at dinner with food, then you're going to be about 2,200. And I actually take 6 a day, so I want to be around, because they say 2,000 to 3,000, so I get up to that 3,000. And I have to say this, because I say to the patients, if you go over all of the good things that occur from this well-absorbed omega, it sounds like you're talking about snake oil. It sounds too good to be true, but it actually is. It actually does give all these benefits, not by magic, because you achieve the right blood levels. Like any other medication, if you take an antibiotic and you don't take the dose the doctor said, and you don't take enough, and you don't achieve the right blood levels, you're not going to kill the bacteria. It's the same thing. This gets you over 2,000 milligrams of these beneficial molecules that will actually begin to do all the things that we do. And we mentioned so much about dry eye and the quality of the oil in the meibomian glands, but it actually represents half of the benefits you can get for preventing macular degeneration. So there's certain pills you can take, and omegas represent half of the benefit that you can take. So omegas not only help you in the front of the eye, they help you prevent macular degeneration.
Well, because in omega-3s, one of the molecules is something called DHA, and our brain, retina, and spinal cord are made predominantly of DNA. Right. So by taking the omega-3s, that's where we can get
it absorbed into your system, so it actually gets to the target tissue, as you mentioned.
And not to get too much off base here, but there's even research showing that the omega-3s are helpful with Alzheimer's and dementia because of the whole brain and right. DHA thing. So, I think it's interesting how we could treat someone's eye condition and then they come in and say, you know what, my cholesterol's 30 points lower, right. My triglycerides are lower, my fingers don't ache as much.
Joint pain, I have almost 600 patients on PRN Omega, and it's called Dry Eye Omega Benefit. And they come in and I say, well, how are your eyes doing? Doc, my eyes are fine. My joints, my back,
I can get out of the chair easier.
Right, all they talk about is their joint pain getting better. Meanwhile, their dry eyes getting better also. Right. Yeah.
And just to touch on also that red blood cell study we were talking about, we mentioned a little bit in one of the other segments how important that research is. And when you and I first started getting into the omega-3s, I think we wanted to prove that this was the best product that we were going to give to our patients. Evidence-based medicine, I think, is what we want to practice. And we did the study. We proved it was, and now we pass that knowledge on to our patients and also on to our colleagues, because you've presented that at meetings, I've presented that research at meetings, and we've both written about it in the journals. So, I think it's really interesting how, again, little Wilkes-Barre, Hazleton, Stroudsburg, Pennsylvania, our knowledge is getting out there to the rest of the world and the country. So, again, folks, we need to take a real quick break here. When we come back, we're going to talk about LASIK. And we talked about correcting our vision with multifocal implants and making you see better without glasses or contacts. But now we need to talk about our younger patients who can benefit from LASIK. So we'll be right back on Eyecare Today. Welcome back, folks. Again, you're watching Eyecare Today. I'm your host, Dr. Thomas Kislan, and again, we're joined by Dr. Frank Bucci. We're on site at the Angelina Teresa Bucci Eye Surgery Center in Wilkes-Barre, Pennsylvania. Dr. Bucci, thanks for joining us again.
A pleasure.
Before the break, we were talking about the health of the eyes and omega-3s, and in our last show, we talked about how we can give patients freedom from glasses or contacts if they have cataracts. Now, let's talk about the 30-ish-year-old patient. Me, 16 years ago, wore thick glasses and contacts, and I came to you and I said, Dr. Bucci, you're the best. I want you to fix my eyes. So we did something called LASIK. You did something on LASIK. Explain to the folks at home what you did to my eyes so that now I can sit here and see clearly.
Okay. Before I tell them exactly what we did, I'll tell them why we chose to work that part of the eye. So LASIK is involved in the cornea. So we talk about freeing people from glasses from 18 to 108, meaning from all that span of lifetime you can be freed from glasses. Just at various segments of your life, it's more one technique is more appropriate than the other. So under 40, like you said, the typical 30-year patient, we want to, as we said earlier, we want to redirect the light rays so they hit the retina. If you're nearsighted, it's going to focus in front of the retina. If you're farsighted, it would be out here. So we want to, for an under 40-year-old, we want to address the outside eye of the cornea. We actually use a laser which makes a flap. Without a blade touching the eye, it makes a flap. We lift that flap, and then there's a second laser that does custom LASIK. And what does that mean? It reshapes the cornea just the way a contact would have a different shape on the cornea. And then the flap goes back, and what that does, it gives the patient almost instantaneous function. They don't have to wait for the surface to heal. And then the light is now directed right to the retina the way they needed glasses or contacts to do that. So literally, when we do LASIK, like we did with Monday this week, within 12 hours, you have 80% of your correction. Within 24 hours, 90%. And in another couple of days, you're up into the high 90s. So, and you do both eyes in the same day, because when you do surgery on the outside of the eye, you're allowed to do both eyes. When we go inside the eye and address the cataract, we have to have at least about a week between surgeries. So it's the same principle of redirecting the light rays that come into the eye so they're in focus. If you're in focus and you have a healthy retina, you're gonna see well. Now, again, as we went back, the lens we put in the what I call the M&M pouch here was doing the same thing because the light had to pass through there, and that was doing the focusing. So under 40, it's usually LASIK, and over 60, 65, frequently it's a cataract. But patients between 45 and 65, they have the option to choose whether they want to redirect the light rays from here with a lens implant or here to have LASIK. And there's pluses and minuses for each one of those things. And we offer free consultations for anyone that wants a refractive evaluation, meaning an evaluation regarding getting rid of glasses. For instance, somebody who's 50 and they hate their bifocals and they don't want to have LASIK and still have to use reading glasses, they may go with the multifocal. And again, we do the same exact surgery and they're getting rid of the substance that's going to turn into a cataract later. So one of the advantages of what we call multi-lex surgery is that you remove the element that's going to turn into a cataract. You get a multifocal implant that gives you distance in the ear. So maybe you would have developed a cataract at age 70, but you have multi-lex at age 50, which gives you both distance in the ear and you get an extra 20 years of no glasses. Now, that doesn't mean that every 50-year-old has to have a multi-lex or a multifocal lens. Some patients elect to do LASIK at that age, and they say, oh, well, my girlfriends wear reading glasses, and that's okay with me. And they go ahead and have their LASIK and get their excellent distance vision and just need reading glasses. But that doesn't preclude them, say at age 50, they had LASIK, and they put in their 10 years of using reading glasses, that maybe at age 60, they go ahead and get the implant. And they've done their 10 years, and now I want to get rid of them. So taking one road doesn't preclude you from having the multi-lex later. And if they and then let's say they were going to get a cataract at age 75, they still had the multi-lex 15 years before the cataract developed. So there's a lot of choices, but to just under 40, you usually do LASIK. 45 to 65, you kind of have a choice, implant or LASIK. And over 65, you probably have even some age-appropriate lens changes. You wouldn't really do LASIK. You're probably going to work with an implant, and it's probably going to be some sort of cataract surgery at that point. But all of these procedures are freeing you from glasses, contacts, reading glasses, bifocals to one degree or another.
And to kind of give the folks at home a little example, you did a while back, in fact, I just saw him for his regular routine exam recently this week. A patient you did of mine was a truck driver in his mid-40s. He said, well, I don't care about my up close. I'll use reading glasses for my log books, and I just want to see great driving at night. So you did LASIK. He was pretty nearsighted. And so he had great far away vision. He uses reading glasses for his logbook. And then as time went on over the next couple of years, he actually started to develop a cataract because he was taking steroids for some systemic arthritis condition. He developed a steroid cataract. So then you went back in, took his cataracts out at the same time, put a multifocal implant in, and now he got rid of his cataracts, and now he sees great without glasses, distance, and up close. So that's how, as patients age, there's, like you said, there's almost a surgery for everybody nowadays. And I just want to go a little bit back toward LASIK and talk about my surgery. And I just want to reiterate to patients, it's not painful. Like you said, it's a couple of 6-7 minutes again. It's a very quick surgery. And in my case, I went home that night. I was a little bit blurry, but I tell patients take a nap for a couple hours. I woke up, my vision was so much better, and I came in to see you the next day. I was almost 20/20, and by that afternoon, I was actually seeing patients. So the visual recovery is really pretty quick with LASIK. So again, is there anything you want to add to that? I mean, there's no pain.
Right, and you don't even need the little butterfly IV that we use for cataract surgery. You don't even need that. We give you oral Valium, kind of take away your anxiety. We use drops and gels to numb the eye.
I didn't even need the Valium, and I'm a big baby, so I didn't even need it.
Well, then we know anybody can do it.
Right, exactly. If I can do it, anybody can do it.
And so yeah, so it's painless. You go into the room and you get both eyes done, where we have the two lasers, and about 16 minutes later you come out and you're already seeing halfway down the chart within 3 minutes. You get a little bit of what I call the waterfall effect that you just kind of described for the remainder of that day. You wake up in the morning, we tell you to go home, take a nap, but you've had the Valium, that kind of, you're relieved that the procedure's over with. You go home and you have your nap and you wake up and you see better then. Little waterfall effect left, and then you wake up in the morning, it's gone. And you have full activity the next day. And with that flap going back, all that has to heal is a little edge, and that heals within hours. And so the next day you have an intact ocular surface, and we've done a lot of preventive for dry eye. With LASIK you can have dry eye. We've done some plugs and have you using extra tears, so we're treating that dry eye, which allows you to function really right away. So it's excellent.
You know, we need to wrap it up here. We covered a lot of material, so just to remind the folks at home, you know, feel free to give us a call if there's any questions. But isn't it amazing where technology's gone in the last 10, 15 years, what we can do for patients now? Isn't it just amazing?
Yeah, you know, when I trained with Dr. Richard Lindstrom, who at the time was the #1 eye surgeon in the world, and I remember doing one of the first PRKs, which was like a pre-LASIK laser procedure, and we would be amazed at correcting someone with, like, say, your nearsightedness. We wouldn't have dreamed that we could take a 60-year-old with a cataract and give them distance and up close, 20/20, no glasses. I mean, it's amazing. As much as I've done thousands and thousands of cases, I'm never bored. I'm always amazed that someone just sits there, and it's a very powerful event to give someone both distance and near vision. It's very, very powerful.
Well, folks, I want to thank Dr. Bucci, and Dr. Bucci, thank you for your dedication and what you do for patients in this area. I mean, we really, truly appreciate it, and thanks for joining us on the show today. Folks, that was a lot of information. Any questions, feel free to give us a call, and catch us next time on Eyecare Today.